Discover Oncapsisens, revolutionary dermatology care for cancer patients. During cancer treatment, it is common to experience skin side effects due to the different therapeutic approaches used, such as chemotherapy, radiotherapy and immunotherapy. These effects may include redness, dryness, itching, hair changes, and sensitivity to the sun. It is important to take care of the skin during this period, keeping it clean, hydrated and protected from the sun. Prospera Biotech's Oncapsisens cream has proven to be effective in improving the comfort and quality of dermatological life of cancer patients, relieving skin symptoms and providing hydration and protection. Although cancer remains a prevalent disease throughout the world, considerable resources are being devoted to research and development of new therapies. Currently, there are a number of treatment options available, which vary depending on the type and stage of the cancer. These options include chemotherapy, radiation therapy, immunotherapy, targeted therapy, hormone therapy, and stem cell transplantation. In some cases, different treatment approaches are combined to effectively address the disease. However, each of these treatments can have side effects on the patient. This is because these treatments not only work on cancer cells, but also on healthy cells in the body. Chemotherapy, for example, can affect rapidly dividing cells, such as cells in the hair, skin, and digestive system, which can lead to hair loss, skin changes, and gastrointestinal problems. Radiation therapy, for its part, uses high-energy radiation to destroy cancer cells, but it can also damage surrounding healthy tissue. This can result in fatigue, skin irritation, and organ problems near the treated area. Immunotherapy, which stimulates the immune system to fight cancer, can trigger an excessive immune response that affects different parts of the body, leading to inflammation and organ damage. Targeted therapy targets specific characteristics of cancer cells, but it can also affect normal cells, which can cause gastrointestinal problems, rashes, and other side effects. Hormone therapy, used primarily for hormone-sensitive cancers, can cause side effects such as hot flashes, vaginal dryness, mood swings, and weight gain. In addition to these physical side effects, cancer treatments can also have an emotional and psychological impact on patients. Fighting cancer can be exhausting and stressful, and the side effects of treatments can make this situation worse. Patients may experience anxiety, depression, changes in body image, and disturbances in daily life. It is important to note that side effects may vary from patient to patient and depend on the type of treatment, the dose administered, the duration of treatment, and the individual response of each patient. Physicians and healthcare professionals are trained to assess and manage these side effects, and will work closely with patients to minimize the negative impact on their quality of life. In summary, cancer treatments are essential in the fight against cancer, but they can also cause side effects in the patient. What side effects can appear during cancer treatment? When cancer treatments are used, side effects are possible due to their impact on healthy tissues and organs in the body. However, it is important to note that not all patients experience the same side effects. Some people may experience only a few of them, while others may not experience any. The severity of the side effects also varies considerably from one individual to another. It is crucial to note that when evaluating these side effects, it is necessary to consider the balance between the discomfort they may cause and the need to destroy cancer cells to achieve the goal of treatment. Each patient is unique and may have an individualized response to treatments. Some people may experience mild and manageable side effects, such as nausea, fatigue, or loss of appetite. Others may experience more serious side effects, such as specific organ damage, decreased immune function, or cardiovascular problems. It is important to note that healthcare professionals are trained to assess and manage these side effects. They work closely with patients to provide comprehensive care and minimize the negative impact on quality of life. In some cases, preventative measures can be taken or complementary treatments offered to mitigate side effects. It is critical that patients communicate openly with their medical team and express any concerns or symptoms they experience during treatment. This allows healthcare professionals to adjust and customize the treatment plan based on individual needs, with the goal of maximizing benefits and minimizing side effects. In short, the side effects of cancer treatments can vary widely from patient to patient. Although they can cause discomfort and concern, they need to be considered in relation to the importance of fighting and destroying cancer cells. Open communication with the medical team and comprehensive care can help manage and mitigate side effects, allowing patients to continue their fight against cancer more effectively. Each type of cancer treatment has a specific mechanism of action, depending on the type of cancer, the organ affected, and the severity of the disease. However, generally speaking, common side effects that may be experienced include anemia, a decrease in the number of red blood cells in the blood, which can cause fatigue, weakness, and shortness of breath. Tiredness, a persistent feeling of fatigue and lack of energy, which can affect the ability to perform daily activities. Muscle and nerve problems. Certain treatments can cause muscle weakness, numbness, tingling, or pain in the extremities. Hair loss. Many chemotherapy treatments can cause temporary hair loss on the scalp, as well as other areas of the body, such as the eyebrows and eyelashes. Skin and nail changes. Some treatments can cause dryness, redness, scaling, itching, tenderness, or changes in skin pigmentation. There may also be nail changes, such as brittleness or discoloration. Changes in appetite. Some patients may experience a decreased or loss of appetite, which can lead to weight loss and weakness. Variations in weight. Some treatments can cause weight gain or loss, which may be related to changes in appetite, fluid retention, or metabolic disturbances. Fertility problems. Certain treatments can affect fertility in both men and women, which may require consideration of fertility preservation options prior to treatment. Variations in sexual desire and function. Some treatments can affect libido, sexual function and fertility, which can have an emotional and physical impact on the intimate life of patients. Gastrointestinal conditions. Treatments may cause effects on the digestive system, such as nausea, vomiting, diarrhea, constipation, abdominal pain, heartburn, or loss of appetite. Mouth, tongue, and throat problems. Some treatments can cause mouth sores, dry mouth, difficulty swallowing, or changes in taste. Occurrence of infections. The decrease in blood cells important to the immune system can increase the risk of infections, such as respiratory, urinary, or skin infections. It is important to note that not all patients will experience all of these side effects, and their severity can vary. Health professionals are trained to manage and control these side effects, and will work closely with patients to minimize their impact on quality of life during cancer treatment. Skin changes. Indeed, as mentioned in the list above, the skin can be affected by cancer treatment. These skin changes are common and can include redness, dryness, itching, scaling, and the appearance of a rash. In some areas of the body, a darkening or lightening of the skin color may be observed. Radiation therapy and certain drugs used in cancer treatment can directly affect cells in the skin and surrounding tissues. The redness, known as erythema, can be caused by inflammation of the blood vessels in the skin. Dry skin is another common effect, as these treatments can decrease the production of natural oils in the skin, resulting in loss of moisture and the rough look and feel. Itching can be a consequence of skin irritation and inflammatory response. Scaling is another possible side effect, as the skin may peel off in the form of flakes or sheets. These skin changes may not only be visible, but may also cause discomfort and affect the patient's quality of life. In addition to these skin changes, sores and cracks in the skin are another important side effect to be aware of. These lesions can develop as a result of skin fragility, decreased production of new cells, and a lack of adequate hydration. Sores can be especially problematic, as they can increase the risk of skin infections and delay the healing process. It is essential that patients communicate with their medical team about any skin changes during cancer treatment. Health professionals can provide specific skincare recommendations, which may include the use of mild, non-irritating products, regular moisturizing of the skin, adequate sun protection, and management of sores or cracks. In some cases, topical medications may be necessary to relieve symptoms and promote skin healing. Also, it is important to remember that each patient may experience these skin changes differently and to varying degrees. Some people may be more susceptible to skin side effects, while others may experience milder or no side effects at all. Health professionals are trained to adapt treatments and provide individualized care according to the needs and tolerance of each patient. In conclusion, cancer treatments can affect the skin in different ways, causing changes such as redness, dryness, itching, scaling, rashes, sores, and cracks. These side effects can cause discomfort and increase the risk of skin infections. It is important to inform healthcare professionals of any skin changes in order to receive proper care and minimize their impact on quality of life during cancer treatment. Radiotherapy. When patients receive radiotherapy treatment, it is common for them to experience a series of skin changes in the treated area, known as radiodermatitis. These skin changes are temporary and affect a large percentage of patients undergoing this type of treatment. The most common symptoms of radiodermatitis include skin redness, dryness, discoloration, itching, and even blistering or peeling. These skin changes usually develop gradually during the course of treatment and may persist for some time after completion. It is important to note that while radiation dermatitis is a common side effect, its severity can vary from patient to patient. Some people may experience mild and transient symptoms, while others may experience more pronounced and prolonged effects. During the entire treatment process, the skin requires special care. It is essential to follow the recommendations and guidelines provided by the medical team and radiotherapy personnel. This may include applying specific moisturizing creams or lotions to protect and soothe the skin, as well as avoiding sun exposure to the treated area and wearing loose, soft clothing. In addition, it is essential to inform the medical team about any changes or new symptoms that are experienced in the skin during treatment. Healthcare personnel are trained to provide proper care and take additional measures if necessary, such as adjusting the radiation therapy dose or providing topical medications to relieve symptoms and promote skin healing. In summary, radiodermatitis is a set of temporary skin lesions that can occur as a result of radiotherapy. These changes include redness, dryness, discoloration, itching, and possibly blistering or peeling. Special care of the skin throughout the treatment process, as well as open communication with the medical team, are fundamental aspects to minimize symptoms and promote skin health during and after radiation therapy. Chemotherapy is a widely used treatment in the fight against cancer. Its mechanism of action is based on the ability of certain drugs to attack and kill rapidly dividing cells, such as cancer cells. However, because it is not just cancer cells that exhibit this characteristic, chemotherapy can also affect other healthy tissues and organs in the body, including the skin. The skin is a constantly renewing organ, and its cells also have a high level of growth and division. Therefore, when receiving chemotherapy, skin cells may be unselectively affected, since the drug cannot distinguish between cancer cells and healthy cells in the skin. This can lead to a number of skin side effects. Some of the more common skin effects during chemotherapy include dryness, redness, tenderness, scaling, itchiness, and even blistering. These effects can vary in intensity and duration depending on the type of drug used, the dose administered, and the individual sensitivity of each patient. It is important to mention that not all patients will experience the same skin side effects during chemotherapy. Some people may experience only mild and temporary symptoms, while others may experience more pronounced and persistent effects. To mitigate skin side effects during chemotherapy, doctors often recommend specific care measures. These may include the use of gentle, fragrance-free skincare products, regular moisturizing, adequate sun protection, and avoiding exposure to irritants such as extreme heat or cold. Additionally, it is important to communicate with the medical team to report any skin changes and receive additional guidance. In summary, chemotherapy is an effective treatment in the fight against cancer, but it can also affect healthy tissues, including the skin, due to its non-selective mechanism of action. Side effects on the skin can vary and include dryness, redness, scaling, itching, and sensitivity. It is important to follow the recommendations of the medical team to care for and protect the skin during chemotherapy and to report any skin changes in order to receive proper care. The likelihood of experiencing different skin problems varies depending on the type of medication used in cancer treatment. Some medicines can cause skin rashes, redness, itching and dryness, while others can cause changes in the color of the skin, nails or hair, as well as increased sensitivity to sunlight, which increases the risk of suffer severe burns. One of the most common side effects in cancer patients is peripheral neuropathy. This condition is characterized by symptoms such as numbness and pain in the extremities, difficulty moving the fingers, excessive sensitivity to hot or cold, tingling, muscle weakness, and itching. The prevalence of peripheral neuropathy varies depending on the chemotherapeutic agent used. It is estimated that it may affect up to 80% of patients treated with paclitaxel and/or docetaxel, and up to 95% of patients treated with oxaliplatin. It is important to note that each patient may experience these side effects differently, and the severity of the symptoms may vary from person to person. Some patients may experience mild and transient symptoms, while others may experience more pronounced and persistent effects. The medical team is trained to evaluate the risks and benefits of each treatment and adjust the doses or modify the medication regimen according to the individual needs of each patient. In addition, there are management and care measures that can help mitigate side effects on the skin and peripheral nervous system. This may include the use of moisturizers, sunscreens, pain relievers, or specific medications for the management of peripheral neuropathy. In summary, cancer treatments can have side effects on the skin and the peripheral nervous system. These effects may vary depending on the type of medication used. Some medications can cause skin problems such as rashes, redness, and dryness, while others can cause changes in the color of your skin, nails, or hair, as well as increase your sensitivity to sunlight. Peripheral neuropathy is another common side effect, characterized by symptoms such as numbness, pain, tingling, and weakness in the extremities. The medical team is prepared to offer management and care measures to mitigate these side effects and improve quality of life during cancer treatment. Targeted therapy. These types of therapies act on characteristics present in cancer cells. However, they can also affect skin cells, as well as other cells in the body. It is true that the skin problems associated with targeted therapy are usually mild and dependent on the dose of medication, but one of the main side effects is a rash reminiscent of an acne breakout. Targeted therapy can also cause tingling, burning, and increased sensitivity to heat in the hands and feet of the treated patient. Of course, cancer therapies, such as targeted therapy, are designed to target specific features present in cancer cells. However, because some of these characteristics are also present in healthy cells, these therapies can affect not only cancer cells, but also skin cells and other cells in the body. In the case of targeted therapy, the associated skin problems are usually mild and depend on the dose of medication administered. One of the most common skin side effects during this type of therapy is the development of a rash similar to an acne breakout. This is because the drugs used in targeted therapy can affect sebum production, which can clog pores and lead to pimples or acne-like lesions. In addition, targeted therapy can cause other side effects on the skin and the peripheral nervous system. Some patients may experience tingling, burning sensations or increased sensitivity to heat in the hands and feet. These symptoms, known as peripheral neuropathy, can be caused by involvement of peripheral nerves due to targeted therapy. It is important to note that the severity of these side effects may vary from patient to patient and will depend on several factors, such as the type of medication used, the dose administered, and each patient's individual response to treatment. The medical team responsible for the treatment will be in a position to provide the necessary support to manage these secondary effects on the skin and peripheral nervous system. Skin care measures such as the use of mild, fragrance-free products, adequate hydration, and sun protection may be recommended. In addition, pain management options or complementary therapies may be provided to alleviate the symptoms of peripheral neuropathy. In summary, targeted therapies in the treatment of cancer can have secondary effects on the skin and the peripheral nervous system. In addition to the acne-like rash, they can also cause peripheral neuropathy, manifested by tingling, burning sensations, and increased sensitivity to heat in the extremities. These side effects can vary in severity and depend on factors such as the type and dose of medication used. The medical team will be available to offer appropriate care and management measures to improve the patient's quality of life during treatment. Immunotherapy. Immunotherapy is a cancer treatment approach that uses the patient's own immune system to fight cancer cells. Although this type of therapy is primarily aimed at specifically targeting cancer cells, it can also affect healthy cells in the process. One of the common side effects of immunotherapy is skin problems. Some patients may experience rashes, itching or blistering of the skin. These effects can vary in severity and may require extra care to relieve symptoms and prevent complications. Also, in some cases, immunotherapy can cause hair loss. This hair loss can occur in localized areas or it can affect the entire body, depending on the treatment and the individual response of the patient. It is important to note that in the case of hair loss associated with immunotherapy, side effects can develop even several months after receiving the treatment. It is crucial to note that each patient may react differently to immunotherapy, and side effects can vary in intensity and duration. The medical team responsible for the treatment will be attentive to the evolution of the patient and will be able to offer recommendations and support measures to mitigate the side effects and improve the quality of life during treatment. In short, immunotherapy, by using the patient's immune system to fight cancer, can have side effects that affect healthy cells, including the skin. Skin problems, such as rashes, itching, and blistering, are common in some patients. Additionally, immunotherapy can cause hair loss, either in localized areas or throughout the body. It is important to note that side effects can develop even several months after treatment. The medical team will be available to provide the necessary support and help manage these side effects appropriately. How to improve skin discomfort caused by cancer treatment. During cancer treatment, it is important to note that the skin can become more sensitive and prone to irritation. Therefore, it is essential to take proper care of the skin during this period to keep it healthy. This involves following some specific guidelines to protect the skin from potential damage, injury, and infection. One of the key aspects of skincare during cancer treatment is keeping it clean. It is recommended to gently wash the skin with mild products without harsh fragrances to avoid further irritation. Furthermore, it is essential to keep the skin properly hydrated, as dryness can be a common side effect of the treatment. Mild, non-irritating moisturizers can be used to prevent and improve dry skin. Sun protection is also essential. During cancer treatment, the skin can become more sensitive to solar radiation, increasing the risk of sunburn and skin damage. Therefore, it is recommended to use a broad-spectrum sunscreen with an adequate sun protection factor, SPF, and to apply it regularly and generously. It is important to note that some products can be irritating to the skin during cancer treatment. It is advised to avoid using products with a high alcohol content or strong fragrances, as they can further sensitize the skin and worsen symptoms. Opting for gentle products specifically designed for sensitive skin can be beneficial. As for the Oncapsisens cream developed by Prospera Biotech, it has been created with the aim of improving skin discomfort in cancer patients. This cream can provide relief and comfort to the skin during treatment, helping to reduce irritation, redness, itching and other associated symptoms. In summary, during cancer treatment, it is essential to take proper care of the skin to keep it healthy and prevent possible complications. This involves keeping the skin clean, hydrated, and protected from the sun. Also, it's important to avoid using irritating products and opt for gentle options specifically designed for sensitive skin. Oncapsisens cream developed by Prospera Biotech may be an option to consider to improve skin discomfort in cancer patients during treatment. In addition to the benefits mentioned above, it is important to note that the Oncapsisens cream developed by Prospera Biotech also has moisturizing and hypoallergenic properties. Skin hydration is a crucial factor in maintaining its health and well-being. During cancer treatment, the skin tends to become drier and prone to dryness, which can lead to discomfort and discomfort. Oncapsisens cream helps to effectively hydrate the skin, helping to relieve dryness and improve its appearance and texture. Furthermore, the cream has been formulated with hypoallergenic ingredients, which means that it has been designed to minimize the risk of allergic reactions. This is especially important for cancer patients, whose skin may be more sensitive during treatment. It is relevant to note that the efficacy of Oncapsisens cream has been supported by a study involving patients from 4 different hospitals. According to the study results, 87% of patients experienced an improvement in their dermatological quality of life index after using the cream. This demonstrates the positive impact that this cream can have on the health and well-being of cancer patients, improving their comfort and quality of life in terms of their skin. In summary, Prospera Biotech's Oncapsisens cream not only offers moisturizing and hypoallergenic benefits for the skin of cancer patients, but has also been shown to be effective in improving the dermatological quality of life index in a multi-hospital study. This supports the usefulness of this cream in the care and comfort of the skin during cancer treatment. An article by Catalina Vidal Ramirez, pharmacist, manager at bio-pharma.es. The information presented in this article is in no way a substitute for the advice of a physician. Any mention in this article of a product does not represent the endorsement of the SDGs, Sustainable Development Goals, for that product.